Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the posterior compartment of the arm. Right, so we said let's take a summary. This is the cross section of your arm. It is skin, superficial fascia, right, and deep fascia. The deep fascia is going to send muscular septa to the lateral and medial portion of the humerus. From the lateral, you're going to have your lateral intermuscular septum. From the medial, you're going to have medial intermuscular septum. So this septum will divide the arm into two compartments. The anterior compartment, which we spoke about, and now we are talking of the posterior compartment. Let's take a look at the muscles that makes the posterior compartment. So the posterior compartment is actually going to be made by the three heads of your tricep muscles. Let's take a look. Right, so the tricep muscle is an extensor muscle, right? A very important extensor muscle, which has three heads. It's going to have a long head that will attach to the infraglenoid tubercle, which we said that this long head will actually stabilize the head of the humerus in the glenohumeral joint inferiorly, right? And then it's going to have a lateral head. The lateral head is actually going to be above the bicipital groove. This is our bicipital groove. So above your bicipital groove, you have the attachment of your lateral head of the tricep. Below the bicipital groove, sorry, this is a radial groove or a spiral groove. Above the spiral groove, you have your lateral head of your tricep. Below the spiral groove, you have your medial head of the tricep. So it has three origins: one, long head, infraglenoid tubercle; lateral head above the radial or spiral groove; medial head below the spiral groove. All these heads, they will meet, form a common tendon that will attach or insert on the olecranon process of the ulna. Right. So this is your long head. This is your lateral head. Right. We have reflected your lateral head. This between is going to be your radial groove. What is found in the radial groove? Your profunda brachial artery, your radial nerve. Above the radial groove, the lateral head of the tricep brachii. Below the radial groove, your medial head of the tricep brachii. Good. So the tricep muscles are going to be innervated by the radial nerve. Let's take a course of the radial nerve. Right. The radial nerve is actually the largest nerve of the brachial plexus, which is a continuation of the posterior cord. So it runs posteriorly and then it's going to leave the axilla by entering through what's called the triangular interval. So remember, we have three spaces. Let me just speak of them now, which are of clinical importance. First, we are going to have a quadrangular space. A quadrangular space is going to accommodate the axillary nerve and the posterior humeral circumflex artery, which is a branch of the third part of the axillary artery. The quadrangular space is going to be made by its superior border is going to be the lower border of the teres minor. Its inferior border is going to be made by the superior border of the teres major. And then its lateral, its medial border is going to be made by the long head of the tricep. and its medial lateral border is going to be made by the surgical neck of your humerus. So this is your quadrangular space. You're also going to have what's called your triangular space. Your triangular space, it accommodates the circumflex scapular vessels. The circumflex scapular artery, which is a branch of the subscapular artery. Remember the subscapular artery, a branch of the axillary artery? Yes, it actually leaves the axilla by entering through the triangular space. As for today, we are mainly concerned by the triangular interval. Your triangular interval is made by the long head of the tricep, the lower border of your teres major, and the shaft of the humerus. So you're going to have your profunda brachii, which is a branch, the largest branch of your brachial artery, together with your radial nerve coming from the posterior cord of the brachial plexus. We enter the posterior compartment of the arm. In the posterior compartment, they will run within the radial groove, supplying the long head, lateral head, medial head of the tricep. Take note, the radial artery will also give what we call posterior cutaneous nerve of the forearm. So it's actually going to send some cutaneous branches that will actually supply the skin in the posterior compartment of your arm. So the radial nerve in the distal portion, distal lateral portion, it will pierce the lateral. You can actually see this is your lateral intermuscular septum. It will pierce the lateral intermuscular septum to enter the anterior compartment. Let's take a look. So right here you can actually see this is your radial nerve now in the lateral compartment, right? A lateral in the anterior compartment of the arm. And in this compartment is going to supply the brachialis, also supply the anconeus, supply the brachioradialis muscle, and the extensor carpi radialis longus. Good. Right. At the very same time, the radial nerve is piercing the lateral intermuscular septum. You have the ulnar nerve piercing the medial intermuscular septum to enter the posterior compartment. Let's take a look at the ulnar nerve in the posterior compartment of the arm. Right. So here is your ulnar nerve. So your ulnar nerve, remember, it will be accompanied with your superior ulnar collateral artery. When the superior ulnar collateral artery will pierce the medial intermuscular septum, it's going to be called your posterior ulnar recurrent artery. Good. So it's also an area of elbow anastomosis here, as we're going to see. This ulnar will actually be traveling posterior in a groove posterior to the medial epicondyle. So therefore it is called a funny bone, because if this ulnar nerve is going to be hit, it's actually going to send some funny sensation in the medial aspect of your forearm and hand. Right, so this is everything I have for you today. Thank you so much and take care.